Joined like we are every week by Dr. Syed Hussain from Trinity Health of New England to talk about various public health topics. Usually it is COVID-19. This is no different. We're going to get into the ending of the public health emergency in just a second. First things first, though, good to see you again, Doctor.
Good to see you, too.
Yeah, glad to have you here. The COVID vaccine strategy from the FDA, that group just met recently to talk about some changes. Why don't you outline what they talked about first?
Sure. They met last week, Tim. They reviewed data. Not surprising that the FDA is now pivoting towards a more sustained structure in terms of how this vaccine will be rolled out annually, similar to what we have for the influenza.
Right.
So in June, during summertime, probably looking at what the most predominant circulating strain is, and based on that, tweaking the vaccine annually to ensure that it is able to provide coverage against the most dominant strain of COVID-19.
And did they also change it so now pretty much every vaccine dose is going to be essentially the newer kinds, what we were using as boosters?
That's right. The bivalent COVID-19 booster is going to be the shot, basically, and retiring the older versions of the COVID-19 vaccine.
All right. So we've been talking about this a lot and reporting that the government is set to end the public health emergency regarding COVID in May. That does not mean COVID is going away. It is just transitioned slowly and is in the process of going to what we call sort of endemic status. Can you sort of tell people what that is, what that means?
Yeah, it's basically how we learn to coexist with COVID-19 and go about our normal lives, our normal routines. What it means is that the extensive public government support that was available for the COVID-19 pandemic will end in May. So the treatments, the subsidized treatments, the vaccines, the testing, the test kits that were mailed out will no longer be the case.
Yeah.
If you do have insurance, it will cover the COVID-19 vaccine and most likely the treatment, but then out of pocket costs may go up a little bit. But what it means, though, is the vigilance that needs to continue around this virus will still be there from a CDC perspective, but the extensive public health emergency will not be in place.
And again, it looks like pretty much the winter wave, at least in Connecticut, is more or less all but gone from the numbers I've seen. So where would you put, and I know it's sort of a personal decision for a lot of people at this point, what precautions they want to take, but what are some of the general best practices that probably we need to keep in effect almost indefinitely just because COVID is not going to be eradicated?
So a couple things. First thing, most important thing is to prevent getting this disease. So that means you need to get the vaccine. Second of all, you always need to keep an eye, especially if you are high risk for developing severe COVID-19 or you live with someone who has a chance of getting a severe COVID-19 disease, they're higher risk. Then those individuals, they need to take into account the transmission levels for COVID-19. And if it's high in your county, then taking some basic precautions such as wearing a mask in an indoor crowded situation, getting tested before a gathering, those things will still be best practice.
Okay. And coming up, maybe next week, want to talk about eradicating a disease is very hard, and we didn't do it with Mpox, but we've come very, very close. I want to talk about the successes and failures with that, but it's good that we are at least getting to the point where COVID is now at the point we can live with it somewhat.
Absolutely.
So that is a good sign. Doctor, thank you so much for joining us again.
Thank you.
Dr. Syed Hussain from Trinity Health in New England. Sorry we ran out of time. There's always so many different topics. We like to get his expert advice and insight on, Matt Scott, as you very well know. I know you listen very intently to this every Wednesday.